Good morning, and thank you for joining us. Our research over the past 2 weeks has been the advantages and disadvantages of major health industry mergers. My name is Miranda Merritt. I am a rising sophomore chemistry dual degree engineering major at Spelman College, originally from Alexandria, Virginia. And I will let my fellow colleagues introduce themselves.
Good morning, everyone. My name is Miles Harris. I'm a rising junior at Fisk University, where I majored in business with a concentration in finance and economics.
Good morning, I am Jasmine Thomas, a second-year pharmacy student at Florida A&M University, and I am originally from Sanford, Florida.
Hello, my name is Kyle Liggins. I'm a chemistry student at University of Missouri, Kansas City, and I'm from St. Louis.
Starting off, what is a business merger? A business merger is a legal consolidation of two entities into one new entity. Their stock, equity interests, and assets are all then controlled by this new entity. It is commonly mistaken as an acquisition. A business merger, they're very friendly, much more of a partnership between two companies. An acquisition, on the other hand, is an ownership where a parent company buys a child company and completely absorbs it. There are 5 types of mergers. However, for the sake of time, we will be talking about 2 of them. The first one is a horizontal merger, where the companies operate within the same field, pushing out the same products and services. Companies in horizontal mergers are usually within industries with few firms, as the competition is very high. So by combining forces, they are able to decrease competition by increasing their market shares. On the other hand, we have a vertical merger, where these companies coming together operate within the same field. However, within different levels of that field, creating different products and services that also create the same end goal. Companies in vertical mergers like to join forces to decrease their operation costs while increasing their market revenue. I will now hand it off to my colleague Jasmine, who will be speaking on our horizontal merger between Catholic Health Initiatives and Dignity Health. Jasmine.
Thank you, Miranda. CHI and Dignity Health is an example of a horizontal merger. Horizontal mergers increase revenue and quickly gain access to new geographical markets. CHI and Dignity Health signed a non-binding agreement to evaluate an alignment between their two systems. This will include more than 700 care sites, 139 hospitals, and more than 25,000 physicians. This, if it is approved, it will be the largest nonprofit Catholic health system according to revenue. The total annual revenue is $28.4 billion. Their vision is to create healthier communities. I will pass it off to Miles to discuss the benefits.
When we look into these 2 major mergers, there are 2 people that benefit directly from these mergers. First being the employees, and second, their marketability. Now, as we know, most of the time when a major merger acquisition happens, employees fear for the loss of their jobs or being displaced. Between the companies of CHI and Dignity Health, there was much upheaval and stress over the security of the employees' jobs. However, due to this merger, a major benefit has come in the fact that in the next 5 years, they will see a 13% increase in their wages. This not only helps keep the employees satisfied, but when the employees are satisfied, the customers are satisfied. And then when we look into their marketability, CHI and Dignity Health has come together to say that they're going to dedicate their resources to first retention and to recruitment of the top talent available. Secondly, they're also going to focus on influencing the technologies that are put in place in their systems, investing into Google and many other devices that bring new tools and products to their customers. Lastly, their availability. They're now going to be present in 28 states, increasing their presence wherever they go and having a footprint that will make them more attractive and more marketable. Thank you. I'll pass it off to Jasmine and she will continue.
CHI and Dignity Health will benefit consumers by expanding access to quality care across 28 states. Now consumers will have access to services in a variety of outpatient and virtual care settings closer to home. The second major advantage is CHI and Dignity Health's clinical programs. These clinical programs target special populations, such as those with disability, foster children, and economically disadvantaged patients. CHI and Dignity Health's clinical programs also target chronic illnesses, such as heart disease, cancer, and diabetes. They ultimately want to reduce the number of deaths according to the Center of Disease Control and Prevention. They want to provide these communities with greater resources. They want to make sure they're getting their needs met. They have access to healthy produce. And they want to build those relationships in these communities to build them up. The third major advantage that CHI and Dignity Health merger will create is a more personalized care experience through advanced digital technology such as stroke robots and Google Glass. They also created a Precision Medicine Alliance. This is the largest community-based precision medicine program in the nation. This program focuses on your own DNA to find out what the best treatment and diagnosis is for you. This program will also implement a precision oncology program in 13 of its states. They also want to create an integrated database for clinical cancer research. From there, they want to advance to more areas such as cardiology. And they want this Precision Medicine Alliance to become a national platform for innovation and research. However, as we stated some advantages to consumers, there is one major disadvantage. Both these companies have collected a lot of debt over the years. CHI has collected debt because of their weak operating positions in Texas and Kentucky. They also have a failing health insurance plan. They are attacking these issues by exiting the insurance business, and they're working with those physicians in those states to improve managing staff and their supplies. Dignity Health's issue is their payer mix challenges. They're focusing on that by helping with the government to provide more provider fee programs. Now we will discuss our vertical merger between CVS and Aetna. Kyle?
Thank you. In this vertical merger between CVS and Aetna, CVS will purchase Aetna for $69 billion. With this purchase, there will be an expansion of 9,700 CVS drugstores, 1,100 MinuteClinics, 4,000 CVS nurses, and over 90 million plan members. Their goal is to increase their local footprint within their communities. Miles will explain the benefits of this merger.
Thank you, Kyle. There are two major benefactors in this vertical merger. The first being the drugstore in CVS, and the second being the insurance company in Aetna. There is one shared benefit that they get by joining in this merger. The major one being the effect that they have against e-commerce. Recently, companies such as Amazon, Berkshire Hathaway, and JP Morgan Chase have had talks of getting involved in the prescription drug market, delivering e-commerce trades that would affect the industry drastically. However, with this merger, they have brought excitement and upward mobility back to their company, which will hopefully lead to better pricing and more economic revenue. Secondly, a benefit that comes to CVS from this is the fact that they become a one-stop shop for all your healthcare needs. Now you can go to their clinics and go 5 minutes around the corner to take care of the majority of your needs and not have to deal with sitting in a hospital all day. The last thing that benefits CVS is they can lower their price because of less operating costs. No longer do they have to debate back and forth with the insurance company. They are the insurance company all in one. What benefits the insurance companies is, first, they drive away the impact of government-aided programs such as Medicare and Medicaid. Now, instead of you having to go into these programs and have to wait in a hospital and go through many different services that are not feasible to your time or your money, You can go 5 minutes around the corner and take care of your needs if you go with Aetna. And the last benefit that they get comes from the lessening of the bureaucracy of their pricing. Now they don't have to focus on where they're going to price with all these different companies and drugstores. You stay with Aetna and CVS, and all is taken care of. I will pass it back to Kyle, who will dive deeper into these benefits and disadvantages.
One of the main advantages to the consumers with this merge will be the reduction in costs. With 1,100 minute clinics, Aetna can encourage their patients to go into a minute clinic for non-emergency needs rather than an emergency department. This is not only more efficient and effective for the patient, but it's cheaper for Aetna to cover. The next major advantage would be the expansion of services that CVS would offer. Within 1 year of this merge, they want to offer 90% of services that you find at a primary care physician's office. This not only is important for patients who don't have hospitals within their nearest communities, but they can also go to a pharmacy, get their pharmaceuticals, and get basic healthcare needs met at a CVS clinic, becoming, like Miles mentioned, a one-stop shop. The next major advantage would be the focus and care that CVS and Aetna will provide. They want to start focusing on chronic illnesses. CVS and Aetna recently mentioned they'll be one of the first to offer in-home dialysis for their patients. They also want to start focusing on their patients with diabetes. Patients with diabetes will be able to have face-to-face consultations in between their visits with their primary care physicians, and CVS also wants to remotely monitor patients' glucose levels from within the store. There are some disadvantages to this merger though, one of them being that this could create a dominated marketplace. If this $69 billion merge is approved, CVS will become one of 4 companies with major traction in this industry. They will basically run how much drug prices cost. They will knock out freestanding pharmacy clinics. They will knock out freestanding health clinics. And they will basically limit patients' options to where they can go. The next major disadvantage to this would be that the benefits could come to the shareholders and not the consumers. In an article by LA Times discussing the apprehension of this merger, Joel W. Hayes, a USC pharmaceutical economist, said that CVS and Aetna will have to prove that this merge will benefit anyone but the shareholders. And he explained this by highlighting how each company involved will make their money. Aetna wants to lower cost of drug prices for their policyholders so they don't have to cover as much. But CVS wants to sell drugs at the highest price possible and as many as they can. With the conflicting goals and views, it's hard to say if any benefits will come to the patient. Now, Miles will conclude.
When we're speaking on multi-billion-dollar mergers, there's sure to be some major implications. Some good, some bad. There are many questions that need to be answered. Will CHI and Dignity Health really be able to push back the problems that they've had with their debt in the past and create a powerful merger that will benefit their customers? Will they also be able to keep employee satisfaction high with 2 different cultures coming together? When we see CVS and Aetna, are they going to actually lower the prices and benefit the patients that come and use their services? Or will they take over the market and create a monopoly that could destroy the health system? There's a million questions that stand to be asked and answered. Only time will tell. But there is one thing that is for sure. In the words of the famous artist, Sam Cooke, a change is going to come.